Setting: hospital ward. You are checking on a 48-year-old patient who has developed osteomyelitis, bone infection in his or her leg. Now let's see the task. First one says, explain your role. Monitor wound, take vital signs, check intravenous drip, then find out how the patient is feeling. Second one says, describe the symptoms of osteomyelitis, such as fever or pain. Third one says, reassure the patient about his or her progress, reduction in fever, positive effect of antibiotics. Fourth one says, find out more details about the pain, changes in level, change of location, any new pain. Fifth one says, give reasons for exploring changes in pain, importance of monitoring possible signs of secondary infection. Sixth one says, advise the patient to communicate any changes in pain, find out if the patient has any other concerns. Seventh one says, explain the treatment stages before discharge, control infection, switch to oral antibiotics, establish self-medication routine. Eighth one says, describe antibiotics treatment plan, several more days intravenously in hospital, 4 to 6 weeks in tablet at home, then establish the patient's willingness to do the necessary checks. Now let's begin the role play. Hi, good morning, John. My name is Adam, your attending nurse for today.
Hi, good morning, nurse.
I'm here to check how your condition is developing and responding to the treatment. Moreover, I need to monitor your wound and take your vitals along with IV drips. Before beginning it, I would like to know, how are you doing right now?
Nurse, I've been feeling a bit feverish since I woke up today and still I'm in a lot of pain.
Oh, I'm really sorry to hear that, John. The fever and the pain are the symptoms of condition osteomyelitis. As you know that, you are currently on intravenous antibiotics and the fever reduction is due to antibiotics. By the way, I would like to get more details about the pain. May I proceed?
The pain isn't any better or worse than it was before.
Alright, do you feel any change in the pain level, or do you have any pain in any other locations or experiencing any new pain?
I don't really understand why you are asking for a change in pain. It hasn't changed. It didn't even get better.
I can understand how frustrating it must be. Let me explain to you the reason for asking the changes in the pain. Keeping track of pain is an important part of monitoring your health. Monitoring your condition is essential to analyze the effectiveness of your treatment. Also, it is crucial to check if there is a possible sign of secondary infection. Therefore, it is highly important to track the pain. So, I would highly recommend you to communicate with us if there is any change in the pain. I hope it is clear to you now.
Sure, nurse. I will communicate it with you.
Do you have any concerns to be clarified?
Yes, nurse. I need some clarification. That is, why I can't take antibiotic tablets instead of the drip so that I can just go home today.
Your thoughts are quite natural, John. Since your infection is not under control, an IV drip is extremely important because it is more effective in this stage, and I can assure you that we can switch you to oral antibiotics once your infection is under control. I hope it's clear to you.
Yes, nurse, I understand that.
Now let me explain to you about the discharge procedure. May I?
Please, nurse.
There are different treatment stages before the discharge. The first stage of the treatment focuses on controlling your infections, followed by stabilizing your health conditions. We can change your IV antibiotics to oral antibiotics. The next stage before the discharge is to initiate a self-medication routine. Okay, John, do you have any more questions for me?
It was really good explanation, nurse. But how long would I have to take the IV antibiotics?
Okay, John, I acknowledge your consent. Let me explain to you the antibiotic treatment plan. That is, you need to follow the IV antibiotics for several more days in the hospital. And then you need to take the antibiotics in tablet form at home for almost 4 to 6 weeks. Okay, John, I hope you understand it well.
Okay, nurse. I will certainly follow your instructions. Thank you.
Is there anything else that need to be clarified, John?
No, nurse. Thank you.
Okay, John, can I have your permission to begin the necessary clinical checks?
Sure, nurse. You may please proceed.
Thank you, John. Before we wrap up, I would like to recap what we have discussed. Until now, we have discussed the importance of tracking the pain level and intravenous antibiotics. I hope you understand it well. Now, please be relaxed here. I'm going to initiate the checks. In between, if you have any questions, you can ask me. I would be glad to help you. Thank you, John, for your kind cooperation and understanding. I wish you a faster recovery.
Thank you, nurse. Thank you very much for your support.
Thank you all. Our role play ends here.